Hey, folks, welcome back. This is part two on my conversation with Claire from the Kento region of Japan. Now she really discussed more post-transplant, how her life has changed, how grateful that she is, and how challenging also it is for her in the beginning. Now she's doing well, thank God, but you will hear from her how her life has changed post-transplant. Once again, thank you for watching this. Please like and subscribe on YouTube and on Instagram at Lung Transplant Nation. Thank you. Enjoy.
I'm welcoming back Claire right now. Took a little break because we were going a half hour. Welcome back, Claire.
Thank
One
you.
thing I wanted to ask you is, what did it feel like when you took your first breath without oxygen? When you realized, like, oh my God, I can breathe on my own. What was that feeling like?
Strange, to be honest. Unfamiliar. But I will also add that the first few breaths, the first perhaps couple of days, I actually felt quite heavy in my chest. It didn't feel very light. And the surgeon did explain to me, he said, a new lung or lungs are like wet sponges. They don't automatically dry out and fill up. It takes time and work to get them working sufficiently. So that's where he encouraged the physical therapy, the moving about, the rehab. And initially, my numbers for the spirometry tests, I thought they were very disappointing because I expected to have much more, And I thought, well, okay, it's not that, to be honest, it wasn't a huge difference from pre-transplant. But then with walking and exercise and so on and so forth, the numbers climbed, much to my astonishment. So yes, don't be put off the first few, days or weeks after transplant. If you feel you're not doing well, it often means your lungs are still adjusting,
Exactly.
It's not immediate. Mm.
Exactly. Something that they told me, it's almost like you gotta build it up. It's almost like learning how to ride a bicycle again. I mean, for me, it was literally I was learning how to breathe again, if that makes sense.
Mm.
Because when I took my first breath, I was like, I was scared. I'm like, do I need, I'm like, I need oxygen. He said, no, you're fine. I'm like, I need oxygen. He said, no, just breathe. So I'm breathing, but I could feel it. It's like I felt like there was a pull. There was a
Yeah.
pull. It
Yep.
hurt to breathe. It hurt to breathe. At the same token, I'm looking at my O2 saturation. He was saying like 99, 98. I haven't seen
Yeah.
those numbers in years. I'm
Yeah.
like, how's that possible? How am I struggling to breathe? And this, I'm like, this is like, I'm like, give me another finger, just it's just the same. I was like, oh my God. But they said, no, you have to be patient with yourself because,
Yes.
surgery is a traumatizing thing. It's a huge surgery. So you got to build that up. That's why they tell you, with the, spirometer to keep practicing as much as you can. And
Yeah.
like you said, you're absolutely right. A lot of times in the beginning, I was getting frustrated. I'm like, why am I not getting up? Now, why I'm not, you know, doing this when I'm not doing this? I said, no, listen, your surgery was more complex than most, and you
Mm.
have to give yourself time. The idea is you are doing the right thing because in your mind you want to do good. You're not giving up, which is great. And we as professionals, this is like mostly like the PT people. They say like we see the difference. We see
Mm.
a little incremental difference. Like at one point you're gonna move your leg. Now at least you can move your leg. Yes, you cannot stand on it, but you can move it from side to side. I was
Mm.
like, oh, but
Yeah.
for it's huge progress. They were very, very happy. But basically they wanted me to have the mindset of a yes, I want to get better. I believe I can get better. So yes, it's a lot of mind games you play with yourself, isn't it?
Yes, exactly. Some days were really good where I had energy and I could, I felt like, oh, I'm on top of this, I'm getting there. And then other days, all I could do was lie in bed and groan, and the nurses would try and encourage me, and I say, no, please, just leave me alone. you know?
Some days are like that. So some days you don't want to hear the doctor. You don't, it's like, okay, I have to take my medication. I'll take. But sometimes you're like, I don't want to do anything, please. But
Yeah.
But you know what? I mean, for me, I had my surgery at New York Presbyterian Columbia. They are
Mm,
really awesome. I mean, obviously the doctors, the nursing staff. I mean, the PT, I mean, OT. I mean, you name them. They were very
mm.
patient. They were very very helpful. It's almost like they believe in me more than I believe in myself. So
Yeah.
because they've seen it so many times, they've seen it before, and they
Yes.
just I just have to keep believing myself, and that was amazing. And it's funny, like when I got a chance, when I have to go to the doctor, like every month I stop by different floors to see if I see some nurses, some doctors. So it was nice seeing some people just to say hi, just to say hello.
Mm,
So once you got home, Claire, in the beginning, I was assuming it was, a little challenging, even though, you were able to walk and everything else. So take me there. Once you got home, um, were you able to? I know you mentioned your daughter. Were you able to get, some outside help? Because that's one thing they at least in here they tell you, make sure you get somebody that can look after you, because even though you might feel good and so on and so on, but you don't want to take a fall. You don't want to overdo it yourself. So what
mm,
was it like for you to kind of readjust yourself back then?
mm. It was big readjustment because I was a bit, I was under the illusion, and it was a big illusion, that I would go home and commence my life uh, almost immediately and things would go back to normal, you know. But of course, that wasn't to be. I got home and it was much harder than I ever imagined it would be. I live in a one floor, on the ground floor, and really I don't have stairs or anything like that to navigate. But I still found it extremely difficult. I do have family. I have a husband and I have two daughters. But my husband and my oldest had to work. They had very hectic jobs. But I was lucky. My youngest, she had a lot of foresight for a young person, and she finished all her university courses beforehand. She finished all her credits so that she could be here with me. So yeah, I was very lucky to have her. And in addition, I had a lady, I still have her coming once a week, who helped me with cleaning. And that was significant because cleaning was so hard. I was exhausted a lot of the time, despite my best efforts to not be exhausted. It was a really big thing coming home, I must say. And my hospital has a policy of sending patients home for a night or two before they fully discharge you,
Oh,
just to make sure that you can manage.
that makes
And if
sense.
you, yeah, they won't discharge you until you've gone home and tried. And some people actually go back to the hospital and say, I'm not ready, and they keep them in until they are. So, but I just wanted to get out of hospital. So I told them I was ready, which is actually very naughty, I think.
You wanted to be home. You wanted to be with your dog, you
Yeah,
know.
I wanted to be home. I wanted my dog, I wanted my life. I wanted my bed. Yeah, so I really wanted to be home. But yes, I did have help and support. So I was very lucky with that, very lucky.
And that is very important. That's one thing I want people that are, especially people that are pre-transplant, to know that hey, it's a team effort. Sometimes our mind we get delusional because that happened to me quite a few times. I feel like, well, I can do this. Why can't I do this? I've done this before. This is secondhand. And then finally, like, oh my God, I'm having a hard time just lifting something that's usually it's not an issue, or
Yes.
or you take a few steps and you're like, did I just climb Mount Everest? What's going on?
Yeah.
It's you out of breath. So yeah, you have to be patient with yourself
Mm,
yourself. And it doesn't have to be a spouse. It could be a friend. It could be an associate.
yeah.
But you need to have that help. You need
Yes, you
to
definitely
have
do.
is
Mm,
because man, if you really try. I mean, I'm not trying to discourage anybody, but just trying to kind of pull that off on your own would be extremely difficult, especially in the beginning. Especially in the
mm,
beginning. I mean, like right now. I mean, even so. Yeah, it's you need to basically quote unquote make your bed get to know people, because even before I went to the operation, I talked to, my relatives, find out, okay, who can be available if I need them, who can come. My eldest daughter, she's living abroad, so she,
Mm.
she's like, okay, I can come in for like, a month, I can help you. And we have great neighbors here, which is awesome. They really help my wife because my kids are young. They still, they like in high school. They were like in middle,
Mm.
and the whole neighborhood helped us. I mean, they had what they did call a train meal. They had like 6, 7 families, and every day somebody would cook something.
Oh, nice.
We didn't have to cook. And I mean, we had like so much leftovers. Like, oh my God, let's slow it down. But it was awesome. Like, they would cook, or if it was snowing at the time, one of the guys would go and shovel. So kind of lift the weight, for her, because she was coming to
Yeah.
the hospital every day with me. So it is important to, and don't be afraid. That's one thing too. Like, don't be afraid to ask people. You'd be surprised. I mean, people that were like, just acquaintances, and step up to the plate and help out and offer to help. I was like, oh my God, thank you. You know what I mean? So it's, but you really have to have a team, a dedicated person to be there for you, especially in the beginning, especially.
Yes, for sure. That's really important. I don't think I could have managed without my family around me. It's not just the physical aspect. I think something that isn't talked about enough in lung transplant is the mental aspects after transplant. It was much harder than I thought it would be. The medication we take, for some people, it doesn't have many side effects. For others, mentally, physically, the effects of these medications can be overwhelming. I found I was a complete lunatic for about a year. Honestly, I mean, small things that wouldn't bother me normally really just
Yeah,
bothered me a lot, depression, anger.
it's
Uh,
it, it partly it's called prednisone. I think you took prednisone. I think that steroid is something else. No, listen, I'm laughing. It's because I totally get it. I totally get it. It's yeah. It can be very difficult, very challenging, and yeah. So it's good, nothing to have people, but to let them know, hey, listen, there are times I'm not gonna be myself, and please
yeah.
don't personally, but yeah, it's
Mm. And
it's
one thing I would mention here is sometimes people mention it, but migraines, I don't know if you had migraines post-transplant, but I had them daily from about 3 months post for about a year. And the doctors say, well, it's probably the medication. And like a lot of times we find doctors are great, but they don't always have answers for everything, which is understandable because, it's so complex. Um, but these migraines were terrible, as in they started mid-morning and they went on all night until I fell asleep. So sometimes there are side effects for which you can do nothing. I did take pain medication, but I never touched the migraines at all. So yes, it's one. Sometimes there are things you just have to battle through, and there's absolutely nothing you can do about it. You just hope it goes away, which it did eventually. Yeah.
absolutely, you're absolutely right. I really believe that everybody reacts differently to different medications. Some
Mm,
lucky that it doesn't bother them. Prednisone makes me gain so much weight. It's
yeah.
unbelievable, and especially I remember one time I had like an infection. Well, I had gotten COVID and got an infection, so they upped my prednisone.
Oh,
Now imagine I was on 10 milligram of prednisone. They bumped me up to 80. So imagine what that made. 80,
nightmare.
yeah, 80 for like
Yeah.
3 days, and then scale down until I got back to 10. But from
Mm,
80, 70, 60, I mean, it was just insane. It's just insane.
yes.
And
Mm,
there was another one I was taking for thrush. I forgot the name of this medication. But for some reason, it's like a liquid. I had to drink it. It just tastes terrible. I felt like I
yeah.
wanted to throw up. It never, I mean, I took it because I had to. But at
Mm,
some point, after like 6 months of this, and I remember I told my people, listen, can I take something else? Is there a pill version of this? It's there's a pill version, but because they said okay, but continue your dental hygiene, you know,
Yeah.
um, floss and brush your teeth and mouthwash. Then if we don't see it, then you don't have to take it. And thank God. But man, that was like the worst. I mean, for most people, like, it doesn't bother them, but for me, it was like make me so nauseous. It made
Yeah.
it to like it's like I feel like I'm gonna throw up every time I take it. It was just horrible. So yeah, different medication have different reaction to different people, to different people.
Absolutely. Mm.
So a couple of quick things. Well, not quick, but a couple of more things I wanted to ask you. You are 4 months post transplant. Would you mind sharing? I know it's ups and down. Was there a time in the last 4 years that kind of really scared you that something with regard to your transplant happened, that you had to be hospitalized, or that never happened?
I was hospitalized once, and this was about a year post-transplant. They had just stopped my antivirals. As you know, we take antivirals for a while. And my donor lung happened to be CMV positive, which is cytomegalovirus. It can be very nasty.
Yes, that happened to a lot of us, unfortunately. Yes.
Yes. And about a week or so after they stopped it, I started getting flu-like symptoms, and I thought, oh, I'm just a bit under the weather. But no, it escalated, and I got really ill. I couldn't walk, and in the end, I went to my hospital, and they admitted me for about 4 weeks, and I was on antivirals again for about a year. And then the doctor said, well, it's time to stop these antivirals now. But I was terrified to stop it because at that time, I thought, well, I've survived the lung transplant and now I'm going to die because of cytomegalovirus. So, but I did stop it, and I felt really unwell after I stopped it. And it could have been withdrawal symptoms. I'm not
Yeah,
sure.
it could have been mental. It could have been mental because
Exactly.
yeah, and that's the thing with the mind that plays, can play a trick on us because we allow it to happen. Because you're right. Because oh man, I remember a quick side story. I had uh, an umbilical hernia for years, and
Mm.
because of my oxygen issue, that my breathing issues, I was on oxygen, so they wouldn't operate me, so I couldn't do it.
Mm.
So I remember, what was it, like late last year? Um, like on maybe August, September. Anyway, I must have eaten something that didn't go with me, and like my stomach balloon. It was like that hernia area was like hard like a golf ball, so hard, and I was like screaming. I mean, I
Mm.
took all kind of aspirin, I mean, you name it. I had to go to the emergency room.
Mm.
The emergency room, and they gave me some strong drugs, and doctors there. She was really nice. She kind of helped push the hernia back in because it was like so inflamed. But I mean, that pain was like so brutal because I feel like my intestine was just being ripped apart.
Oh gosh.
Goodness, and it was horrible. I stayed overnight, and then slowly but surely. But so anytime, like, if I feel like something wrong with my stomach, I said, the first quick reaction is panic. I'm like,
Yeah.
okay, let's slow it down. Let whatever this is, let's sort it out. Because
Mm.
we had such a huge surgery, so like you said, any little thing that's not a little thing, but anything that's really bothering us, it's like, oh my God, is this it? You know what
Yeah,
I mean?
it's
So
back.
you
Yeah.
this quick flashback in your head, which is understandable, but it's something that we have to fight through. One
Mm.
last thing I want to ask you, um, with regards to COVID. I mean, once 2021 in the middle of COVID, and that's another thing that was very difficult because people couldn't come and see me besides my wife and my kids.
Yeah.
I was little in a bubble. How did COVID affect you, or is it affecting you? Because some people say they push them, they don't wear a mask, But me, I still wear a mask when I go out. I try not to go to, even though I love to go to a concert, but I really try not to get myself in in an enclosed space with a ton of people.
Yeah.
I finally took flew for the holidays. I went to see some relatives, and so that was my first flight post transplant, and I was nervous as heck, to be honest with you. So,
Mm.
how has the whole COVID then affected you in your way of life as a transplant patient?
Well, I couldn't go out, especially at the beginning of COVID. I stayed home a lot. It was hard staying at home because I had this new lung, sorry, and I wanted to do things. I wanted to get out the house. I wanted to use it. And I have a friend she had her transplant very close to when I did. And sometimes we would commiserate with each other by saying, well, we went through all this, this transplant, and now we're stuck at home. So it was a little bit frustrating at the time. But both of us agreed that, well, yes, I'm stuck at home, but I have to protect this lung or these lungs as best as I can. So yes, I did stay at home a lot. I did not see friends. I did not go anywhere crowded. The only thing I allowed myself to do was to walk with my dog outside where there was very few people, and I wouldn't be worried that I was going to contract COVID. It was difficult, and now in Japan we all still wear masks. There is no law that says we have to wear masks outside. Of course, all the shops and restaurants, they require it, but Japanese people have always worn masks, especially during winter. It's to stop the spread of influenza or common cold or whatever. So we're not adverse to it. We're used to it. So I feel quite safe going out now because everyone wears a mask. I know some people don't agree with it, but for us culturally, it's acceptable, and nobody blinks an eye. We're all just used to doing it, and slowly the regulations, I think, are coming down where we can remove our masks more. Out in public, walking on the street, we don't require them, but people still wear them. But I shall continue wearing my mask because I must do what I can to protect my lung. It doesn't mean that because I wear a mask, I'm not living a good life. I am. So I'm satisfied with that.
No, exactly. I mean, I'm glad you said that culturally, this is what it is. And it's definitely an easier transition for you because, yes, 2020, some part 2021, but in here, once it lifted the mask requirement, everybody's like, oh my God. I'm like, really? Was it that bad? I mean, was it that bad? You had to wear a mask not only to protect yourself, to protect somebody else,
Yeah.
I mean, here for some reason it's a whole political thing. It's not even a health thing, to be honest with you.
Yeah.
So, I mean, when I go out, if I'm walking around, there are times I want to feel the fresh air. No people, no one around. I don't wear my mask.
No, exactly.
Before I go into a store or anything else, I put my mask on. And you know what? And to me, it doesn't matter what somebody else feels about it. That's to me, I got to protect myself and my family.
Yeah.
So I didn't go that just so absolutely. Lastly, and first of all, I want to really thank you, Claire, for taking the time out of your day. I really appreciate that.
No, thank you.
I want to ask you is what would you say to people that are pre-transplant? Because people like we had a lot of questions. I'm sure people have a lot of questions. What message would you say to them that you think can help them go through the whole process?
Well, firstly, it has to be your decision. You cannot make a decision based on what people are telling you to do, because ultimately we sort of walk this road alone. You get help, yes, but there are adjustments to be made. There is a lot of discipline involved with being a transplant patient with regards to what you eat, your medication, being physically fit. Don't go in it half-heartedly. If you really want to do this, You have to be prepared to sacrifice some things, but think of what you gain. You gain an awful lot from being able to breathe and live again. It's not easy, but it's doable, and you can still live a very, very good, in fact, you live a very good life if you compare it to when you're sick and on oxygen in a wheelchair. The exchanges, you've got to be willing to do everything required of you, which is actually not difficult, Also, I would say to people going into this, don't be afraid to read the hard stuff. Don't read something that frightens you and think, no, I can't do that. None of us went into this with courage. The courage has to form slowly. And for me, reading stories, reading papers, reading research made me have more questions about the process, about what happens. And when you have more questions, you ask more questions of your doctors and of fellow transplantees. You get more answers, and answers and knowledge will dispel a lot of your fear. If you decide to go on this journey, go at it like a bull at a gate, and just don't back down until you've achieved the best you can. It doesn't have to be perfect. Just the best you can, I think, is sufficient. And I wish everyone luck. And I thank Sasha very, very much for this opportunity to talk about transplant. It's been a real pleasure.
And thanks again, and thanks for your message to everybody else. And absolutely, it was a pleasure. I really found it therapeutic to talk to somebody else that went through a lung transplant.
Yeah, me too.
Yeah, absolutely. So I really want to thank you for the bottom of my heart. And thank you for taking the time to do this. We'll definitely chat on the Facebook group of Lung Transplant Taking Flight. And,
yes.
And we'll definitely be in touch. Hopefully we can do that again in the future. But I really appreciate your time. Thank you very much. Let me see if I remember any of the Japanese. Domo arigato. Is that good? There we go.
Thank you very
much. Thank you so much. You have a great day, Claire.
You too. Thank you. Bye.
Well, folks, that was part 2 of my conversation with Claire, and I want to thank her from the bottom of my heart, really, for giving me the time, because we have 14 hours difference between us, so we really had to coordinate. So that was a lot of fun. Please like and subscribe on my YouTube channel, Lung Transplant Nation, and also on Instagram, so I can bring you more of this conversation with people that are post-transplant. And I'm also looking forward to have conversation with people that are pre-transplant. I know there are a lot of anxieties there, because I know I had a lot of anxiety when I was pre-transplant. So please stay tuned, and I'll see you soon. Have a great day.